The best of Money Matters. The Big Story.
Welcome to The Big Story. I'm Hongbin, Jeong. Now, there are reports of a new virus spreading. China is experiencing a surge in infections of a respiratory virus, leading to public concerns about an outbreak. The virus, identified as human metapneumovirus, or HMPV, has seen cases spiking across northern Chinese provinces this winter, particularly among children. Photos and videos of people wearing masks in hospitals in China emerged on social media platforms, and local reports suggested hospitals were becoming crowded. India, Malaysia, and Kazakhstan are also among other countries that have reported cases of this virus. Experts say China's rise in HMPV cases is consistent with global patterns. But how does the disease compare to COVID-19? And how can we protect ourselves? Well, to find out more, joining us today is Professor Dale Fisher, Director at the Center for Infectious Disease Emergency Response at NUS. Professor Dale, welcome back to the show.
Yeah, hi again, Hongbin.
Thank you so much for joining us. So, Professor, what is HMPV? Is this a new virus? Can you help us provide some historical context about how or when it was first discovered?
Well, yeah, it was first discovered in 2001 by scientists in the Netherlands. As they look back, it looks like it's been around for probably 50 years more before that in animals. So we postulate a spillover event possibly from birds to enter humans around 20 years ago.
I see. So how is HMPV transmitted from person to person? Are there any specific environmental or behavioral factors that are contributing to this spread?
Yeah, certainly nothing specific. It's a respiratory virus. So in that sense, its transmission can really be looked at the same as COVID or influenza. You inhale it, or you can, by touching, get it into your mouth, and it attaches to the mucosa of the respiratory tract, and you have to get it from someone else who's infected, basically. So the things, as with COVID and influenza and RSV and other infections, it's overcrowding, particularly in poor ventilated areas, and someone in there has the infection, so it can spread that way.
I see. So how does HMPV compare to other respiratory viruses such as influenza or even the common cold?
Well, I think people can consider them all as similar enough. Certainly clinically, they're similar enough. You wouldn't sit there and assess your symptoms and go, I think I've got HMPV. So people can consider them the same. Of course, there's some important differences, like for COVID and influenza, there's treatments, there's vaccines, whereas that's not the case with the metapneumovirus. So really it's just like the other things that we'll compare, and people don't really need to see a doctor or even get a test unless they're deteriorating. Deteriorating, I mean, it might transform into pneumonia, or if you've got asthma or emphysema, it can cause flares of those especially in the elderly. So I think, people can lump them all into these respiratory viruses and manage them as a cold unless they feel something's wrong.
I see. Well, Professor, you mentioned earlier that this virus was first discovered back in 2001, but why are we now seeing a rise of HMPV cases around the world, particularly in countries like China, India, and even Malaysia?
Okay, so there's probably a bit to tease out with that question, because they'll be different. Now, China, they're talking about it being in the northern provinces, right? So very cold. People huddle indoors, close the windows and doors, and so you create a poor ventilated thing, and everyone's crowded in, if you like. So it's quite normal to see that sort of seasonal variation with respiratory viruses. It'll be the same. We know it's the same with influenza, but I don't think we can accredit that sort of seasonal changes to India and Malaysia so much. So what could be going on there? In looking at the reports in India, it's quite amazing that they're concerned. They're really reporting single-figure numbers of cases, and why in India they need to say they've diagnosed 5 cases of metapneumovirus really doesn't make any sense. And they're also saying that there's no clinical increase. So they monitor influenza-like illness, so just the clinical things without the microbiology testing. So they say they're not increasing, and admissions to hospital for respiratory illness is not increasing. So I think the India one might just be they've probably done more testing, and maybe they've heard about what's happening in China, so they've done some tests that they otherwise may not have. So I've got some doubts about the concerns there, although, hey, I'm very happy for people to be vigilant. And it might be a similar thing in Malaysia if they say they've gone up 45% from 200 and something to 300 and something, and that 100 extra positives in a country the size of Malaysia is really not a lot. So I think we need to be careful of interpreting the data, because if they're just doing more testing and they're more sensitive and they're more alert to look out for it, then that might not be an increase in numbers, because, as I said earlier, most people wouldn't even get diagnosed. So you've only got to increase the testing and you get that sort of pseudo increase, if you like, just because you're identifying it better.
I see. Well, an uptick of the HMPV virus in China, of course, has ignited dire headlines and social media posts. We've seen videos posted on social media of crowded hospitals, which have prompted speculation about the start of another global outbreak. So, Professor, should the severity of HMPV be considered a major public health concern at this time, similar to the level of impact from COVID-19 pandemic?
Yeah, you mentioned dire headlines, and I think this is a double-edged sword, looking at it that way. In one sense, it's good that countries and the public is aware and identifying these things, but also you don't want to be crying wolf too often, or else people just end up sort of, I guess, getting immune to the concerns, if you like. And what's happening in China, it's not unusual for hospitals in wintertime to be stressed more because of influenza and metapneumovirus and probably COVID now. So taking pictures of crowded hospitals at this time of year, I wouldn't say is something to panic about. As I say, good that they're concerned, but really you've got to listen to the authorities who are really interpreting and monitoring the system properly. You mentioned the COVID and the severity, and I think the people really need to understand the difference with a novel virus. You don't have that immunity that's pre-existing, and that was COVID in 2020 and 2021. While we got vaccinated and slowly people became infected, but in a safe way, if you like. You're not going to. So the needs, I guess, in COVID during those tough years were extreme, but that's not going to happen with an endemic virus like metapneumovirus. Let me tell you, by the age of 5, it's said that everyone's been exposed to it. Everyone in the world has antibodies to it. So that's why children under 5 are probably more at risk. But really the rest of the world's population has already seen the virus and developed some immunity. So that's why it's not so severe.
I see. Well, then, do you believe that some of the fears of the HMPV cases may perhaps be overblown, especially as a reflection of the fears that COVID-19 has instilled in people all over the world?
I'd rather see it as people are sensitized to the risks of outbreaks, and as I say, this is a good side of the double-edged sword. But people need to also understand that an endemic problem like this is not going to do what COVID did to us in 2020. So this is why the situation really needs to be interpreted by experts, if you like. But it's good that the public can see that there might be a problem, and this is where the communications and the interpretation needs to be very fair on the population, I think.
I see. Well, earlier, Professor, we mentioned that HMPV cases are on the rise, particularly closer to home. Malaysia has seen 327 cases of these infections in 2024, a 45% rise from 2023. But what's the likelihood of HMPV spreading here in Singapore? Do we know anything about the current HMPV situation here or what to expect in the coming months?
Well, yeah, let me firstly say it is spreading here, and it's an endemic condition. So we see it in hospital in children with pneumonia. So it's here. We shouldn't be worried about what's happening in China because we already have it. We shouldn't be worried about seasonal changes because it happens all year. There's transmissions all year round. Right. But I would probably say that if there is an increase at this time of year, you might expect that with, Christmas and Chinese New Year and a lot more people getting together, a lot more exposures. So this sort of festive period can be a time where you see respiratory infections increase.
I see. Well, once a person is diagnosed with HMPV, then what treatment options are available here in Singapore to manage the illness?
Yeah, there's no specific antiviral treatment as there is with flu and COVID. Mm-hmm. So it's just supportive. As I mentioned earlier, if you get an exacerbation of your asthma or your emphysema, then that can definitely be treated with the appropriate medications. Mm. There's comfort measures. You could take some paracetamol to bring down the fever. You could give them fluids if they're getting a little bit dehydrated. But really there's nothing specific for metapneumovirus.
I see. Are there specific ways to help us, stop the virus from spreading? How can Singaporeans protect themselves from being even exposed to the virus in the first place?
So it's about breaking that chain of transmission of respiratory viruses. So you can, whether you stop it at the source, so people that are sick should stay home, should wear a mask, this sort of thing. People that are vulnerable can avoid crowds and poorly ventilated areas, cough etiquette, social distancing, all these things like blah blah. But as we've gone through in COVID, it's the same measures to prevent spread. Now, obviously, we don't need to go into circuit breakers and lockdowns and things like that for something without the severity of COVID on immune-naive people. But there are ways to protect yourself and protect others.
I see. Well, are there any potential for new strains of HMPV to emerge? How concerned should we be about this virus becoming more dangerous in the future?
So I wouldn't say the public should be concerned. It's really about the country having adequate surveillance systems, and in a way that's what you're seeing in these countries that are reporting the cases. Obviously Singapore's excellent, so I don't think we should be worried. Signals for increased severity, you're talking about if HMPV mutates, I think, and if you saw more cases presenting, more patients being admitted, even deaths, and they were due to HMPV, then that would be a position where you'd want to study it a lot harder. But really, I think it's unlikely with HMPV. But yeah, if there's more transmission, that can be seasonal or it can be due to testing. But more severe, we're not seeing any suggestion of that, to my knowledge.
I see. And before we let you go here, Professor, as we look into the future, what are the most important steps that health officials can take to ensure better management and control of HMPV?
My take on this is this shouldn't be about HMPV. This should be about systems for outbreak preparedness and response, those pillars of outbreak response. Are they working? And I think we're seeing a lot of them work in this uptick. The surveillance is obviously in place. It seems like good testing. The communications with the public, healthcare workers need to be clear and adequate. Managing that infodemic, the social media stuff, making sure that what's being told to the public is true. Observing hospital infection control and hospital surge capacities. So all those things that are important in outbreak management can actually be observed and practiced during this HMPV episode because all these problems are appearing. So, but I don't believe the next pandemic is going to be caused by HMPV, but I think it will be caused by another respiratory virus. So this is an opportunity, if you like, to practice those measures.
I see. Well, thank you so much, Professor, for your time and your insights today.
Thanks, Hongbin.
Thank you. We've been speaking with Professor Dale Fisher, Director at the Center for Infectious Disease Emergency Response at NUS. This has been The Big Story with me, Hongbin Jeong.
To listen to more great interviews, download our podcasts at audio.sg or download the audio app. That's AWEDIO, audio at the App Store and Google Play.